if I got that all right. Well, we'll learn a little bit about Britt. So thank you so much, Britt, for joining us. I know you're sort of in transition from moving from one part of the South to another. And so maybe you can tell us a little bit about your journey, what made you become a movement disorder neurologist, and then we'll get a little bit more into the integrative medicine side of things.
Absolutely. Thank you for having me, Indu. It's a pleasure to be here. So yes, I I have had quite the circuitous journey, kind of from the South up north and then back down. So I'm from Mississippi originally, the northeast corner, and grew up there. But my mother is actually from the West Indies, from the Bahamas. So there's this kind of Caribbean influence as well. I left after I graduated high school, lived in Nashville for 8 years doing my undergrad at Vanderbilt and my medical school at Meharry Medical College, which is a historically Black medical school in Nashville. And then moved to the East Coast for my training. So at University of Pennsylvania for my neurology residency, and then NYU for my movement disorders fellowship before moving to Austin for my first grown-up job 6 years ago. I would say that kind of what pulled me to movement, I'd wanted to be a doctor as long as I could remember, but neurology was really interesting to me because I was a neuroscience major in undergrad. So I loved the idea of how the brain is kind of the master of everything else, and how it was kind of a new frontier for the ways we think about who we are and how to treat diseases that for a long time we thought had no cure or was just part of getting older. And so that was really appealing to me. I think for movement, I love the idea of longevity in a relationship with a patient. And you get the opportunity to be with someone every few months in clinic for years, as opposed to just meeting them in the hospital and then going about your way after you've discharged them. And so I like relationships, like Christmas cards and catching up on how the grandkids are doing and that sort of thing with my patients. And I also really like the integrated way that movement impacts the entire body. And because of that, then I can't just kind of sit in this little tower thinking about the brain and the nervous system. I have to think about the whole person. And that really applies a lot to my philosophy of medicine anyway.
Yeah, I think we vibe the same with that. So, and we've had some chats and things like that, and we're interested in kind of, a little bit of a different approach, I think, is what is needed, and new faces, I think, as well, sort of representing. So, so proud that you're coming back. So, what will be your new role then, in at Vanderbilt, and how will you integrate that with your other, your alma mater there?
Sure. So I'll be an assistant professor, clinical professor there. So I'll be seeing patients, but also there to, teach kind of on the job for fellows, medical students, residents, hopefully pull some people into movement land that are coming up and figuring out what they want to do. I also am going to be helping to facilitate a multidisciplinary clinic for advanced Parkinson's disease and atypical Parkinsonism, which I'm really, really excited about. And so this fellowship and the kind of COVID silver lining of having the time to do this herbal medicine course all kind of seems like a bit of synergy towards this role that I really kind of found me. I wasn't looking for it.
So already in the comments, there's Bonnie says, looking forward to meeting Dr. Stone here in Middle Tennessee. And then Deb Jones writes, Texas's losses, Tennessee's gain. Dr. Stone is the best. Miss you, Dr. Stone. So you already have some fan club out here. I didn't even know.
Gail, I know.
Like there's a few folks from Tennessee. So yeah, love that. Love the love from the South. But so I think, one of the things, maybe we'll just start with this, and then we can get more into the integrative medicine side of things. Because I think I'd like to just start with, obviously we are women of color, right? Which already puts us in a bit of a unique spot as doctors. And we bring sort of that knowledge, I think, of just the skin, the bodies that we live in, but what the context is of who we are. And so I think we're working and largely trained in sort of a traditional medical system, which has not been developed by people that look like us and not necessarily for people that look like us. So how do we navigate? How have you navigated that, Britt? I mean, I think, you probably went to a medical school that already was, traditionally Black. So how have you then, in these other spaces sort of taken that knowledge and sort of tried to impart it to other people? And maybe also, what have you had to tolerate or withstand on the way?
Sure. I would say that a lot of what I realized I had taken away, I found out after I was taken out of that medical school experience. You only know what you know. And even though I grew up in largely kind of, majority spaces, and then found myself in this historically Black medical school where all my professors were largely Black and all of my class was largely Black and the patient population was, which really isn't the way that life normally is. I kind of soaked that up, I think, subconsciously, and then went back into the world that we're used to being in, and kind of got this jarring, oh, wait, that was an exception, or that was a concentration of something that's not the norm. And so I think that what I really brought with me was this importance of listening to patients, of meeting people where they are, and really trying to get an understanding of that. I was talking to another colleague about how we often are crunched for time. There's all this paperwork we have to do. There's all the business of medicine that often vies for our time. And so we get into these, kind of rhythms and routines, and things can often become autopilot where, well, I see this amount of patients every day. I have 30 minutes. That's it. And then you can just not take the time to have that little bit of curiosity to go, well, wait, they said this thing. Maybe I should go circle back and ask. Or they've mentioned something that's not related to my system, but it's important to the overarching. Like, I have this cough that I can't get rid of. Have you talked to your primary about that? Just these little things that often it's so easy to go, well, that's not important. That's not me. I don't have time for this. And I found that when I'm slow down enough to pay attention to that little voice, that's often where things that really lead me down a path that has ramifications start to come up. And I believe a lot of that came from the teachers I had in medical school, really emphasizing, like, you can look things up in a book, you can study, you can do, but this is the thing that you have to learn. Listen to your patient, pay attention to your patient.
I love that. It's giving me chills a bit because it's been so long since I've actually heard that. And I think that's fundamentally what it's about. But so much of what I do, even at the VA, I'm sitting there talking to, a patient, and the trainees, they're sort of just trained to type the note, type the this and that. And we're all, and I'm holding the patient's hand, and, we're having a very tender moment, and people are just missing it. There's sort of this need, we're in this sort of mill where I think that the metrics that we're judged on, right, of like, our VUs and how much, how many patients and how many, staying ahead of the schedule and documenting everything. And in this, within 24 hours, we have to sign everything and this. It just almost is like opposite, and kind of makes a framework that is opposite to what you just said, which is just sort of, taking a moment, being in the space, present with the patient at that moment. And that voice that you talked about is also kind of interesting, because there is periodically you sort of, when you've done this maybe long enough, or maybe it's like, just being a connector or a people person, but there's sometimes a sense that you feel like, well, I feel like he's trying to tell me, what is it that I'm missing here? And you just, and it's sort of this moment sometimes when you're able, it's that art, right, of medicine or something. It's the sort of sweetness that kind of comes from the human interaction. And sometimes it is, it's interesting that you call it a voice or a sense. It's that sort of sense of something, either danger or, something that you're missing, that you kind of have to go down. And I think, I've had discussions, my husband's a radiologist, and we've talked about, artificial intelligence replacing us as, providers or whatever. And I don't feel like as a Parkinson's doc that will ever happen. But maybe you could speak a little bit more. What is that voice? What do you think that is?
Well, one, I agree with you that of all the fields, there's no way that AI can do what we do. It's just not possible. And for me, what is that voice? My faith is very important to me. And I also believe that, regardless of one's faith, there is an intuition that we often are not always encouraged to cultivate and listen to. And, some of us, we really, like, it just comes naturally and it's there. For other people, it has to be practiced. And for all of us, like, if you don't listen, then it can get quieter and quieter. And I think the art of medicine is learning how to pay attention to that. It might be what you call your gut or just that second guessing, but sometimes there's just something that's quiet and still, and you do. It's like this, like if I allow there to be a little bit of silence, then I get the yes or that's not it. And if you're in a rush, that's when you miss it.
Yeah. Yeah. And so much of what we do is really try to tell people to take their pills on time, right? And then exercise and go eat this and that. And I've been spending a lot of time in this space where, I know what I have to do for myself and what makes me feel better, but I'm sometimes not motivated even to do it. I'm like, no, I'll just stay in bed and, not go to that exercise class or, eat that donut that my children have bought in my house or whatever. And you feel bad, you feel kind of not so well afterwards, but it's hard sometimes to comply. But then we, in this context again of this largely, think about the main people that we serve with our Western framework as, probably white men who are affluent, who are married with Parkinson's, is like educated, people that have resources. And we then come up with a framework of what we call wellness, which I like to define as sort of this proactive lifestyle choices that people can make. It's kind of on this road to thriving, in their lives, not just, curing a symptom, but really sort of picking things. But, sometimes that is not fully possible. And I've been sort of struggling with how to keep people, motivated from a cultural context as well, though, right? So the things that I know and we study, so like 30 minutes on an exercise bike, getting your heart rate up to this, how do I take that and teach that to some of the people that are out there that, you are trying to serve now and I'm trying to reach as well? How do we translate that?
I think sometimes it's also being sensitive to a culture, knowing what things might be a good proxy for maybe what we've come up with. So, like being in Central Texas, I might have a large Latinx community. And so, for them, it might not be, for my older patients getting on a bike, but it might be dancing when they're in their kid. They cook. They will cook even if they can't get up and walk around. They will have the cutting board to cut whatever it is for their grandchildren, for their children, because cooking is love. And in that same way, music and dance are such an integrated part of their lives that I had one gentleman who told me, he's like, well, yeah, when I freeze, I do a little salsa move and that breaks my freeze. And I was like, are you kidding me? That's ingenious. Like, I never. And so then I was like, I'm going to file this away. Yeah. And I have all, you can count, you can march, you can also salsa dance.
Yeah.
So, it's just kind of having people tell you what are the things that give them joy that they don't even realize actually, if they were to make it a part of their regular day to day, would be wellness for them.
Yeah. 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 I think we've sort of put all these things in such a commercialized box. People think of wellness as like some expensive yoga pants that they need to buy, and then a, fancy gym membership and some, spa day or whatever that's going to call a retreat. But I think it's really about lifestyle choices that are day to day. And it sounds like, so that's again, part of that communication, right? It's sort of like, hey, your patient just told you something, and then you try to then sort of apply that to other patients. And sometimes I think one of the things that we've been doing on this series is just sort of even learning from each other. So maybe in the chat, people can write if there's little things in their wellness strategies that they've found that are kind of fun and out of the box, that aren't the exact, sleep 8 hours a day and drink 40 ounces of water. Maybe people can take that. But David's also saying, yay for the mostly younger clinicians embracing a multi and interdisciplinary approach. So powerful, especially in our PD world. Somebody wrote, singing is very effective breathing. Yeah. So, I think, sort of just taking, and even, I've been talking about mindfulness and, doing some studies in that realm, but I think, you can be mindful in other ways. And actually you just described, a mindful patient interaction where you just, we're talking, you took a moment and you were just like tapping into what with being present with this other person. And there was sort of this kind of a connection that kind of came out of that, it sounds like, right? So I know you've also been studying some things as well recently, right? In these, and I think that what drew you to that sort of out of the box kind of, because it sounds like you've had some out of the box training already, right? So yeah. Now, you've been in practice for a while. Tell us about that experience and why you felt the need to shift out of that and get other training.
Sure. So, I finished my fellowship. I was kind of, I find it comical that I'm going back to academic medicine because I think I'd felt kind of tired. And I thought, you know what? I just want to see patients. That's all I want to do. I'm going to do that. And so, we are about 5 years into this is year 6, almost year 7 now. So At that point, I think I realized, I think we maybe didn't have a lot of students rotating through, but we started having a couple of residents, and I really enjoyed the residents coming and teaching them. And then medical students wanted to come through, and I thought, I really like teaching. This is just as enjoyable as seeing patients. Actually, I like doing both of them. And then I started getting asked questions by patients, and the support group in our area, the Georgetown support group in particular, had said, well, do you want to do some talks about anything you're interested in? And, maybe some non-motor symptoms in Parkinson's, or sleep, or pain. And as I started kind of, coming up with my talks and thinking about the ways we treat, I was like, I mean, yes, we can prescribe something for this symptom that is not Parkinson's medicine, but is also something, in the broader scheme. But then people have a bunch of other medicines going on, and they have a whole bunch of other side effects. And there's got to be some more holistic way to address some of these issues. And this is where my mother and the kind of West Indian background comes in. She had for years is like, you should really think about doing an alternative medicine, training or something about plants, because I'm sure there's lots of things. And I know, doctor, that a lot of drugs come from plants. And I was like, well, Mom, you're right. I should look into this. And then of course life just got busy. And then the pandemic hit. And I had money for medical education funds and no conferences to go to. And I thought, well, why don't I see if there's an herbal medicine course that's local? And I found an excellent course. And the teacher she's lovely, because she really kind of embodied that idea of, let's bring alongside our Western medicine with the traditions of the past. And, there's quackery everywhere. And so let's just be critical thinkers and think about how we can integrate these things for the good of our own health and the health of whomever we might be working with, if you're a doctor or a nurse or a therapist, etc. And that's kind of how I ended up taking this herbal medicine course. And I started implementing some of the things that I was learning with my patients, and it has been really, really gratifying for sure.
How cool. So the teacher is, what's the background of the teacher? Was it?
So the teacher is she's an herbalist. She's not in the medical field otherwise. Then I'll give her a shout because she's just lovely. Her name is Ginger Webb, and it's the Sacred Journey School of Herbalism. And so they had to completely revamp everything for the pandemic. And so they were remote. And then if you lived in the area, you then did your outdoor foraging and nature walks on the weekends. But I mean, just someone that I will always keep in touch with and pick the brain of from this point forward.
How cool. So teach us a little bit about what you learned from that, maybe some general principles about herbs, because we haven't explored that. And this is, this is after all holistic.
Yeah.
So I'd love to learn a little bit about you. And then from that, just generally what you learned. And then also, what were the pearls that you think that we can take away for our Parkinson's patients, and their caregivers even maybe?
Yeah. So I think one thing I learned is, we live in a natural world that is, in order to be in this world, you must be from nature in some way. And to that end, we have evolved in concert with our environment, and that includes plants. And we know that a lot of our pharmaceuticals come from plant, compounds. But when you think of something being created on large scale for pharma, you have to isolate a compound from this thing to then, make this pill, right? Whereas if you think about a plant, and I don't want to get woo-woo on you, but really the idea that the plant itself in its matrix has all the things that it needs to deliver what it ought to, whatever organism is eating or ingesting it. So, things, for example, like we know, that ginger is great for nausea, and so is peppermint, settles the stomach, and that not everything works for everyone. Some people have an allergy to something. So just because something's a plant doesn't mean like it isn't going to potentially cause harm or that you can overdo it. You can overdo anything. This idea of balance, and that, that if we are natural and food is fuel and plants are part of that, that plants can also contribute to our healing. So, having a healthy diet is a great way, and also incorporating herbs into your diet can also be really beneficial. And they've actually done some studies for, the things that you try to isolate. For example, if you try to take, a compound from a carrot, you don't get the same benefit as eating the actual carrot itself. So what is it about the whole carrot that's different than, the beta carotene in it? And that whole idea that your body then knows what to do with what it's coming in contact with. And so I really liked the idea of also the side that plants can often help synergize whatever pharmaceutical med you might need. So there are some herbs that can be beneficial when you're taking an antibiotic for an infection. It makes the antibiotic even more effective. And then you take it for a short course and you're done. I think some pearls that I've taken away, particularly for my Parkinson's patients, is there are a lot of people that have kind of seborrheic dermatitis, or this kind of itchy, scaly skin, and then you try to figure out what to do for it. And so there are lots of kind of natural salves and oils that can be infused with plants like calendula or rosemary that can be helpful in the itching and the kind of scaly and dry skin that you can do topically. So maybe you don't need to get a steroid ointment for that. You can save your steroid for something you really need. If you have sleep issues and it's not, some profound, problem, but it's just maybe a little bit of insomnia or frequent awakening, you can, create a ritual around your bedtime and maybe try it first doing something like valerian or chamomile at night before you go for something that's prescribed, unless you have something, of course, being discussed with your neurologist, REM behavior disorder, these sorts of things. But maybe if it's just the beginnings of creating this kind of healthy ritual around your sleep, that might actually be a nice first step. So
yeah, absolutely. That's really cool. I mean, I think a lot of it is, I've definitely been connecting more with nature in the pandemic. I mean, it's been a source of great actual comfort for me, just to get, in my backyard and notice, and I've noticed even walking in my neighborhood that there are flowers and things that I was like, was that here like last year? Because I walk by the same neighborhood, but I've just been so much more present and taking photos and, sort of, but it's really remarkable how amazing some of the stuff is. But I agree in Ayurvedic traditions, I mean, we've been trying to figure out, about curcumin and, turmeric and stuff, and people like take that and powder it and they put it in capsules, and then they, try to get people to ingest it and see if it works, to duplicate, how it works in populations. And I think that's really missing some of the beauty of, in Ayurvedic tradition. It's really about eating seasonally, growing some of this stuff yourself, knowing all the parts of the plant, sometimes, getting in the soil, harvesting it. I think some of the soil has to do with it, different parts of the plant, cooking different things with different things. So you're really, if you're using some of these turmeric things, you're cooking it with fat like butter, ghee, whatever, and then you're adding black pepper sometimes and ginger, and sort of this whole sort of armamentarium of things that you're eating together with other people in a meal, and with sort of combining a lot of sort of herbs in there. We put cilantro and other sorts of things. I'm actually getting hungry right now just talking about these recipes.
Sounds so good.
But it's really about not just that, and I think so much of what we do in Western medicine is just try to figure out what the molecule is and try to duplicate it in a randomized control trial. And I think some of these Eastern kind of or other approaches, I mean, even like you were talking about the Caribbean approaches, I mean, each of our cultures probably historically has rich things that your mom taught you, that my mom taught me, that we've just done forever. When we would get a stomach ache, my grandmother would make this like a ginger tea, and turmeric and milk was what we had when we were feeling this and that. And now you can, people are trying to sort of find these ways to kind of duplicate these. This is sort of interesting. So I think, again, listening to sort of where we're from even sometimes, and thinking about what maybe gave us comfort even as children, or what our parents would have, given us. Sometimes I think there's something to that a little bit. So it's kind of exciting. So Ava writes something about valerian in Cinemet. Is that contraindicated? I'm not aware of that, but I think
I'm not aware of that either. I think there might be something with the SSRIs.
Yes, yeah, I think I think there might be with the antidepressants, but I think valerian's okay. Somebody else writes something about probiotics. Do you have a comment on that from your perspective, and maybe what you learned from the herbal scene?
Definitely a fan of probiotics, because we know gut health is very important in Parkinson's, for you to be able to absorb your levodopa, for you to actually have energy and feel energized. Constipation is not our friend, none of us, but especially for our Parkinson's patients. So I often will encourage people to do a probiotic And that was encouraged as well, even in my herbal medicine class.
And did you guys learn about prebiotics as well? Like what kind of things to eat to help with gut health as well? Do you have any sense of that?
Sure. So there was a big emphasis in how we even structured the class were through the chakras, but also this idea of the taste, and that each taste kind of governs a certain part of the body. And so bitter was a very important taste. And it's one that, especially in the Western world, we often seem to stray away from, with the exception of maybe black coffee. And now, darker chocolates are becoming more popular. But that the bitter increases more, of course, acidity, which then and salivation, which then allows you to begin to digest more efficiently. And so there's a very big push towards having bitters as kind of a pre-food prep to kind of get your system ready to break down your food. So.
Oh, interesting. So would there be something you'd eat or drink? Is that in a drink or?
So yes, it could be in a drink. It could be in a tincture, a couple of ideas, and sour also, both sour and bitter. So hibiscus is something, hibiscus tea, which a lot of us in kind of in the central Texas area know because of the summers, and it's very cooling as well. There's also kind of, even if you're someone who likes the bitters in alcohol, so like Amaro and these aperitifs, a lot of those drinks. There's one called Nocino. It's like a walnut, like a green walnut liqueur, strangely, that people use. I'm trying to think of another off the top of my head.
Yeah, but a lot of those aperitifs, I think, have that sort of bitter sort of, and they sort of are supposed to, help your digestion or whatever. So,
exactly.
People are also asking about constipation ideas as well. Do you have any tips on what you learned about constipation treatment?
So we know, of course, hydration is key, because if you don't hydrate, then anything else you're doing is kind of a moot point. But even, psyllium is one of the herbal treatments for constipation. Activity, we know that's a huge component too, and moving around as much as possible. And when you're eating more fresh fruits and veggies, so the bulk of that is really great. So, all of your green veggies are going to be great, lettuces. So in fact, we talked about the idea that you want to have cucumber, watermelon, things that have a lot of water content in them also will be very helpful in helping with constipation, and having enough of those servings in a day. A lot of times we just don't eat enough fruits and vegetables. It's not that we aren't eating them at all, it's just how much. And to the same end, I think something that you mentioned, Indu, about when we're doing trials and thinking about if some things are helpful or not, sometimes, and my instructor said, that the actual doses are way lower than what they would actually, if you went to an herbalist, they'd recommend. And so that can sometimes be an issue too, is that a treatment dose is different than just, sprinkling some rosemary, over your potatoes.
Absolutely. So, yeah. One thing that has been interesting, and we had a dietitian give a lecture at the VA, and she put up some beautiful slides of salads with lots of colorful vegetables and beautiful offerings. But then, you think about our patients and some of the patients that you're going to be seeing. And many of my veterans too, they don't have access to this sort of, greens and herbs and things that we're talking about. So what are some ideas? Do you have ideas for just ways that people can start to maybe get access or incorporate some of this if they live in, a food desert where they really, I know driving around LA, some places there's like a liquor store, like maybe a convenience store too. Sometimes a farmer's market that they have to travel to, but not a lot, some little local gardens, maybe that they could grow things. So yeah, maybe give us some tips on what we can do. If that's happening now and you're a patient or caregiver, but then also as sort of a group of docs that are, or healthcare providers, how can we, fix these pictures a little bit better?
No, I think for starters, perfection is the enemy of good. So it can be so daunting if you're like, well, that's not even here, I just give up because I don't even know where to start. And so I say sometimes start with one thing. Maybe it might just be target your breakfast. And so what do I eat for breakfast? Maybe is there a way that I can, be more intentional about that? And for some of my patients, what I did is I gave them a list. I was like, do you, can you find, like, here's the grocery store, go to the HEB. This is our local grocery store. And I want you to get some apples. I want you to get some oats, some flaxseed, like just start there. And let's do that for a month. And then we'll tackle your lunch. And then we'll get to your snacks. And then maybe also while we're figuring this out, there might become more of a community opportunity for, things like access to farmers markets. I know we actually had a farmers market in the parking lot of our hospital on Saturdays, which was really nice. And so patients would often come there because it can be overwhelming too. Like, what if you don't cook? Like, where do you even start? How do you pick out these vegetables? How do you even know, And so that's kind of, I just tell people to try to get it into chunks that are manageable, not just this overwhelming overhaul they have to do instantaneously.
Yeah. Yeah. No, I think that's a good tip to start with breakfast, actually, because people then think, when they're trying to do dinner, they got, it's too much. So I think the breakfast idea, that's brilliant. I love that. So people are mentioning some urban farming is becoming more popular. There's quite a few in San Francisco and Oakland. And I think, I think even just growing some herbs maybe in your own windowsill, if you can.
Your own windowsill garden is great. I mean, the key ones, you can start with mint, rosemary, and thyme, or something like that, or just pick one and just start with that one and see, kind of see how it goes. And you might be surprised at how much you actually like enjoy it too.
Yeah, I know it's fun. It's fun to watch the plants grow as well. So one other idea would be, I think, with these herbs too, I think one of the problems that patients have is that there's a lack of taste, right? The taste changes because the sense of smell changes. So I think we've been talking about, I have some folks that really don't necessarily enjoy their meals as much. And so one of the things that I've been telling them is maybe to add some extra herbs and maybe even spices and stuff like that. So do you have a sense of that sort of as well?
Yes. No, that definitely is something that I have seen too. And, often my patients that don't enjoy their meals, and this is not always the case, but a lot of them often also have some blood pressure issues, particularly where they err on the side of being low, which means that I can add a little bit more salt, which is nice. And so then that ends up being, and I've had some people who are like, I added some cayenne and salt, and that really changed it. I was like, yeah. So.
Yeah, I think people like it when we tell them they can add some salt, right? Because they've gone through their sort of older aging lives trying to minimize this. Somebody asked about bitter melon. Do you have any sense of bitter melon? We use it a little bit in Indian cooking. Do you guys use that at all?
I don't. Now I know there's. I think if it's the one that I'm thinking, I don't know if it's the same as bitter gourd. If that's the same family, then yes, because my grandma used to give that to us in the summers. The leaves of it, she'd make into a tea. That was quite bitter because she said that she needed to get our appetites up.
Oh, interesting. Okay. If it is I think the bitter gourd in Indian cooking, I know that's supposed to help with sugar and like diabetes kind of stability and stuff like that as well. So, so I think that's good. So tell us a little bit more about the course. So how long did it take? And then tell us about this foraging and things. That sounds kind of fun. It's for all of us, maybe.
It was lots of fun. So it started in September. And it actually ended the beginning of May. So every Monday night, it was a crash course. So we had 3 hours online where we went through whichever system we were doing, and then with associated reading. And then on Saturdays, we would meet on someone's wild land, either someone in the class who had a ranch or a property, or friends that my instructor had developed relationships with. And depending on what was in season, like literally we would all this was in COVID, we were all in little pods with mask on, and she had her walking stick and we'd walk out and she'd point to something and tell us like, this is its Latin name, and then this is how you use it. And we learned how to identify plants in the wild because of that. We had books with us where we'd identify the leaves and I think it was called tree keying, where you look at the leaf and then identify the tree based on a set of keys. And if there was enough of something because it was in season, then we were able to harvest it. And then we would make our own tinctures and salves and infused oils and And so I learned how to I made elderberry syrup during the, kind of cold flu season. I made an infused juniper oil that I then turned into a salve, and I gave to the older people in my family because it's really good for aches and pains as a topical. I made an echinacea tincture for when you kind of feel like you're about to get sick to kind of help boost the immune system. And then at the end, it was over 200 hours altogether that we did from September to May. And then at the end, we each had to pick a plant that we did a presentation on, and then brought something to either eat or drink or to give to people. And so mine was rosemary, which for the literature nerds out here, in Hamlet, when Ophelia is about to kind of lose it, she's going around handing out these plants and naming them and telling them what it stands for. And one of the lines is, rosemary, that's for remembrance. Please remember me. And so rosemary is supposed to be really, really helpful potentially in cognitive kind of sharpness and kind of warding off brain fog, which is one of those things that a lot of my patients complain about. So I've been telling people to maybe give that a try. I haven't had anyone tell me yet if they find it beneficial, but that was my course. And I made friends and learned a lot, have a lot of new books to read. So
Oh, fun. That sounds amazing. I would love to take a course like that. People are asking if you have an idea for muscle tension or some cramps, things like that, that might be topical.
Oh yeah, muscle. Okay, so topical things for muscle cramps. One that I actually even use for myself is CBD ointment. I find it to be really beneficial for muscle spasm and cramping. And then also actually a salve that has either peppermint or juniper, something that has that kind of aromatic oil in it. That can be really helpful as well, topically. Think of anything else that comes to mind.
I think arnica too, right?
Arnica is another one. Yes.
Yeah. But yeah, I think anything with peppermint also, I think it has some salicylates in it that kind of diffuse. And I agree. I think the CBD, that's, I'm quite cautious with using CBD anywhere, ingested, but I think but
topical, that's your friend.
Yeah. Exactly. Any edible things for cramping that you had tried?
I haven't tried anything edible for cramping at this point.
It's mostly just
mostly it's topical. Since usually you have a certain place, and one of the things we talked about is that if there's a particular location, sometimes topical might be more ideal, so you're not getting this whole systemic effect.
Right. That's probably very reasonable. And then people are also asking about numbness or freezing. I don't know if you have any thoughts on that from a herbal standpoint.
So numbness, I don't. Freezing, I have not had anything herbal related to freezing that I've seen yet. And I will say that one thing that I actually want to kind of dig into further for my own education is kind of some of the neurological aspects of herbs, because we kind of hit the ground running with the general overview of the whole body. And so I think there's a lot of kind of deep diving that can be done.
Yeah. And if people feel like things help them, you can type it in the chat too. I think like from my perspective, ginger, absolutely for nausea. And sometimes I'll give that for people who have some nausea related to the Parkinson medication. I think for sleep, I think chamomile is great. Sometimes lavender as well, sort of even like kind of in the bed or in it sort of can be very calming. Like we talked about the peppermints and things, sometimes just for, sort of the topical things, or even, to help digest. And I think sometimes the sense of smell, it can be very interesting with, I think just either calming or exciting. I know sometimes things can wake you up just by smelling, citrus and things. So it's so fascinating how some of these senses can really be tapped into, and similarly, presumably taste as well. So what other things, Britt, did you sort of take away? What is your sort of wellness? I mean, and I know you recorded some stuff for me, so I know you know that you do a similar spiel, but I think maybe you could just tell me sort of what your sort of bottom line of the things that patients should try to do and incorporate in their daily routines, maybe from your perspective.
Well, I would say, and something you said earlier that I wanted to circle back to, which I think is key, is that it's not just the ingesting of the plants. It is actually getting out into the natural world. That is be its own form of medicine. To be still and like feel the wind on your face, or to take your shoes off and be able to put your feet in the grass, or to have your hands in the dirt, or to hear the birds sing. Like there's something really therapeutic about being in nature as well. And it doesn't have to be something fancy schmancy. It can be a walk in your neighborhood with a sidewalk, but you see these beautiful plants with the trees moving and the birds are flying. And that in itself is just as healing. And so when I tell patients what a day should look like for them, you want time to be still, to practice maybe some gratitude and some presence. You also want time with people you love. And we figured out after this pandemic how much we need each other, that we need that social interaction, with our family, with our neighbors, even just like friendly, smiley strangers. Like we need people. And we need to be touched by people. We need hugs and a pat on the back and, someone to hold your hand. You need that. You need laughter, a good night's rest, or at least a nice nap at some point during the day. You want to eat things that are fresh and vibrant, and that don't just, serve your body, but also like they get you excited, like they look pretty, and if you can smell, they smell nicely. And, you want to just be as fully in your senses as possible. And we can sometimes lose that in just like the day to day. And there's so much that's stressful and there's so much that's going on. But I think just trying to find those times of gratitude and just really being present in the midst of your day, get moving in some way, listen to something that makes you happy or is pretty. I'm a big music person, but a music or a book or a poem, just any of these things, in addition to the things that about, taking your medicines on time and doing all these other things. I think wellness is really about a quality of life. And that's, you want to have a life that feels well lived. And even with ways that you have to kind of, navigate around things that seem like barriers, or maybe something gets thrown in that changes the way your life has been, there's always another way that you can pivot and find something else that can have some joy. So that's how I feel about wellness altogether.
Absolutely. I totally agree with you. And you also mentioned getting sort of in touch with what brings you joy and what's meaningful to you, brings you purpose. How do you help people identify that? Because it sounds like you spend a little time sort of helping, sort of listening and trying to help people navigate. So what is the question? What are the sort of key questions that you sort of have found can bring people to kind of gather that for themselves?
I ask people, what's a day like for you, to get an understanding of what they're doing. Especially if I want to insert like, why don't you try doing this? Then I'm always like, so what do you do in a day? And then I ask people, like, if you could do anything, what would you be doing? And that's often a very telling. I get a lot of answers when I say that, because then they're kind of like, oh, well, no one's ever asked me that.
Yeah. So people are, talking about valor as an essential oil. I don't know.
Oh, yes, I'm familiar with that. Yes.
So it sounds like people are using that for muscle cramps. Some people are using sandalwood, and sandalwoods we use a lot in Indian. You make a paste out of it, and actually the smell is amazing, and you can sometimes put it on your body and even on your face for different sorts of things. People are, David saying that you inspired him to pick some rosemary. Amy's asking about mushrooms and mushroom foraging. Is it a fad, or is it, what do you think about mushrooms?
Mushrooms, the new frontier. Mushrooms are going to change the world, is what everyone's saying. So that's actually something I'm interested in. And because, of course, the fungi kingdom is its own thing, I haven't gotten to delve into that so much. But I think there's definitely something to be had. I would say you always want to be careful with your foraging of mushrooms, because you could pick the wrong one and things could go very badly. So you really, really want to be careful about finding them in the wild if you don't know what you're looking for. But there's been a lot of study of like things like lion's mane, which was used a lot in Chinese medicine and reishi. Cordyceps. There's so many that are kind of thought as adaptogens, which for those of you that aren't familiar with that term, it's kind of the idea that what your body needs at that time, then this, adaptogen will do. So they might be modulating of like our immune system. So if you need your immune system to be ramped up, then they kind of help stimulate. And if you need it to calm down, then they kind of calm it down a bit. Or they do the same thing with your thyroid, or a host of other like kind of hormonal things going on in the body. So that's kind of the idea of an adaptogen, and that quite a few mushrooms kind of seem to live in that space. So I have to do more research, but I do think mushrooms might be something worth. And I mean, and if you like them, it's a low bar. Start eating some shiitake and lion's mane more regularly, right? Like, who knows?
I agree. I think they're very under appreciated, and I think they're hugely powerful, very potent. So yes, I agree. They can be very probably damaging if you take the wrong ones, and poisonous actually in some situations, right? And so we want to have people, learn about them, and go maybe with somebody who knows. It's amazing that you were able to find a teacher and then go out in nature and in a group. It sounds just like the perfect afternoon and something to look forward to. And then, if there are ones at the grocery store, I think, mixing it up and trying them out. And certainly I think mushrooms, I don't eat meat. So we use mushrooms sometimes as a meat substitute, and sort of my boys like them as well. So yeah, people are asking also about sources of protein that could be recommended. I don't know too much about your diet, Britt, but maybe you could talk a little bit about that. If we're sort of not recommending red meat, what do you tell people?
Sure. Yeah. So I would say if red meat is not on your agenda, beans are great. Lentils, really great for protein. You could go, of course, kind of the soy route with tofu and seitan and that sort of thing too. I mean, once again, mushrooms are really great. They are wonderful, and they have that nice kind of, if you miss meat, they kind of texture as well, and really can hold up nicely in a lot of ways that meat is used.
Nuts sometimes also have
Nuts
protein.
are great. Yeah.
Yeah.
I eat meat, but I definitely in the last few years have kind of been decreasing my amount. And it's amazing. Like, if you told me 10 years ago that I would have done that, I would have scoffed. And now I'm like, it's really okay. Like it's amazing how you can adjust to something new. And I actually have told patients, you might want to just give it a try. Like, just minimize, maybe do a meatless Monday and see how you feel, and compare it to other days. And you would be surprised at how you feel differently. So
yeah, I think absolutely. People are talking about maitake mushrooms are delicious, and portobello mushrooms can rival a good steak. So totally agree. People are still asking about herbs interfering with carbidopa levodopa. I don't know of any, honestly, that interfere with cinnamon. I think you're good to go with, everything in moderation. Of course, we don't want you eating a whole bushel of mint or whatever, but I think,
Exactly.
I think you can certainly add it. And sometimes just adding a little bit of herbs in a salad can kind of like, you're like, oh, what did I just, bite into or whatever. It can be actually pretty awesome. And then even the onion garlic kind of family, I think, can be good from a prebiotic sort of standpoint as well. So I wanted to ask you, we have about 10 minutes left, Britt, and we could talk all day about all this stuff, and maybe cook together sometime, and hopefully enjoy some aperitifs and things like that in person someday at a meeting. But I wanted to ask you, just given your cultural background and sort of the work that you're planning to undertake, I think, Sarah had mentioned that, we all talk about sort of trying to engage populations more, trying to meet people where they are, and trying to really, get people to engage in support groups, maybe engage in clinical trials, engage in clinical care. You can certainly, I think you've had some experience in the Latinx communities, but you and I have both spoken about how there's a real lack of representation of Black men and women in medicine, and certainly in movement disorders. I think you and I went through the list of people, and I know a lot of people, and a lot of people, and we were like maybe 10 in the world that we could really identify, which is really, not good, because we need, there's lots of studies that show that patients, do better probably when the person who's treating them is sort of looks like them, or they can, deeply identify with who's helping them. So how do we fix this issue? And maybe, you can speak maybe largely around the Black, and if you want to add something about Latinx as well, let me know.
Sure. I mean, I think with the Black community, I think there are many factors. And I think one big one is this understandable, wariness of the healthcare system. Because I think when we think about racial disparities, just to be really honest, like, we know that is endemic in our country, in every place. If racism is a construct, a social construct, but it is implemented by people, whether it's real or not, in actuality, people then are in all of these different realms of world, doing all their different jobs, and then that then impacts the systems. And so, I think that it's really obvious then that you're going to have people who are practicing medicine with their biases and with actual prejudice that they might even also be aware of, that then shape how they interact with patients. And I think that something that's really important is to, one, raise awareness about, we know about kind of unconscious bias because we're humans. We know how our brains work. It's really hard for us to look at every person individually in every situation as the first thing we've seen. Like we build up experiences and we react accordingly, right? Knowing that is the key. So that then when we are interacting with people who maybe bring up something in us, we don't go with the script. If the script is negative, we're able to go, actually, but I have higher thinking than that. And I can now opt out of this script and be intentional here. And so I think that instead of making it even like a morality issue, making it just a stop and pause issue for providers with who are the groups. Women are often, dismissed, not paid attention to. We downplay their complaints, and that's a gender issue. And then we learn this in our training as women. So as a woman, I can perpetuate that same disregard to someone who is me because I get taught that. So it's not just men doing this or not just white people doing this. Like we internalize these ways of being taught, which I think we're able then to go, oh, okay, this is not just like you're a bad person. It's like, no, this is something that is a part of the system. So how do we then identify it so we can start to pull it away from how we're managing our patients? And I think when patients see that you actually care about them as a person, then a lot of that distrust starts to get chipped away out, because people also are coming in with their bad experiences they've had with doctors that have nothing to do with you. And then they're like, oh, that doctor asked me how my day was. They didn't just look at the computer. They like turned around and looked at me. And that's never happened before. And so then that gruffness kind of starts to melt, and then you start to get in, and then you're able to actually affect change, or that person thinks to themselves, that doctor didn't just give me some recommendations that would cost a bunch of money. They met me where I was. Like they knew that like I couldn't afford to do XYZ. And so I think it's on our end as the provider, as the physician, it's being able to kind of lead with an openness to someone who might be suspicious of our intentions and our angle, and realize that actually we are there to help facilitate making sure they get the best care. And I think that when we're able to do that, and then we can actually help with things like health literacy, because you can't get health literacy if someone doesn't want to listen to you.
Yep.
So first it's about that relationship. If you can get that, then you can get people to trust you, and then you can educate, and then people are like, oh, maybe I will sign up for that trial.
And then they teach others that are like them, and then the circle is hopefully better. So and yeah, it's sort of one of these things where I think we have to figure out how to communicate and really listen and pause. I think what you said multiple times is, listening and pausing, just sort of this, like at some point, two humans realizing that they're both there for the right, end solution. It's, that to help the person who's suffering. It's not to, check a box or to pretend to, I think there's a lot of, people who are in it, as Sarah had said at the beginning, to check a box or to just like, the surface. And then as soon as you start getting into the hard part, then they're like, okay, I get, peace out. I gotta go, but I think these hard discussions are what we need to do is sort of realize that, the system is flawed, but we have been part of that. And we need to sort of take a moment and recognize our own part of it. And then how do we pivot from that and move forward together in a community of, meeting people, like you said, where they are, and not this, like, I'm the doctor, you're the patient. And I think the script that you mentioned where people then, it's like, oh, patient is non-compliant. You even see it in the chart, non-compliant, doesn't do this, won't take their pills, like disappear, and we don't realize why. Sometimes it's because they had to take 3 buses to get here, and then somebody stole their medicine because they're homeless, and this and this and this, and they have no way of getting physical therapy because they can't afford the copay, and they can't, get the food that we, told them to get because they have basically, a 7-Eleven to go to as the only store. So I think we just, really have to start educating a little bit differently and taking the time. So I think, you and I have done some integrative medicine study, and I think that's sort of been, I think, the bottom line of some of this, thinking a little bit more holistically about people and really what the social determinants are, what really defines health in a different way. So maybe, Britt, I'll just give you the last couple of minutes. As I mentioned, this just flew by, and it's such a pleasure to have you on and see your beautiful smile and wait. We'll have another one of these once you've been in practice a little bit with that new community that you're going to serve. I'm so excited to hear how it's going and how you can teach us, because it's not enough just to, like you said, you sort of were in this bubble of care, right? Where it was like the sort of like everyone kind of looked like each other and kind of got it. And then as soon as you left, you're like, wait, what did I just, So I think I'd love to hear more about how to, create that sort of environment and obviously not that bubble to help people feel met, and heard. But yeah, I'll give you the last couple minutes to wrap up and inspire us.
I think, well, one, thank you so much for having me. This has been so much fun. And I've been seeing the chat pop up, and I think patients of mine have been in here, which, I see Mr. Benedict. That makes me very happy. Oh my goodness. So I'm like, I'm not going to cry. But, I think that what I really have wanted, so, a little personal bit is that in the last year, I lost both of my grandparents. My dad's parents each died, one in July and one in February of this year. And for both of them, they were physically very healthy, but then dementia was the issue for each of them individually, a different type. And they were back home in Mississippi, and the care that they experienced was atrocious. And so when I think about, my grandparents, and they were excellent patients, they went to the doctor always, and they did what the doctor told them. They took all their medicines, and I watched my grandma like change her diet from, all the fried things with all the pork, to, getting way more healthy in her later years. And so, when I think of what my role is, and particularly in my patient population, which often are people that are the age of my grandparents, it is to make sure that my elders, and then ultimately, my peers, because if I'm lucky enough, I'll be an elder one day, to make sure that they get the best care and the best quality of life they can have before it ends. And, to be diagnosed with a neurodegenerative disorder, Parkinson's or something like that, everyone has plans of what they expect their life to look like when they get older, the golden years and retiring and doing all these things. And then you get a diagnosis and you feel like the bottom's been pulled out from underneath you. And so what I hope to impart to the people that I'm able to train, what I hope for our roles for patients who have this happen is, what? The bottom's not been pulled out. It's just that a curveball's been thrown. And how do we help you now adjust to this new place? And how do we walk alongside you? How do we build a community of people? How do we get your family involved to make sure that you get to live the best life that you can until it ends? And so that's really, that's what motivates me.
Absolutely. Well, we'll do it together, Britt, you and I, and our patients, and Sarah, and all of y'all. So we'll all walk alongside of each other. It's going to be a pretty big pavement probably, but we'll sidewalk. We'll have to figure it out. But anyway, well, thank you so much for spending this hour. It was so lovely. And I look forward to learning more from you. And thanks, Sarah, for hosting. I'll pass it back to you guys.
Oh, absolutely wonderful conversations. I made a note to myself not to eat a bushel of mint, but it was actually a really good idea because I thought that would help my breath. But I loved this, and the reminder to pause. I mean, I feel like that was woven throughout the whole thing. Pause and be present. Something that we just can't build enough skill in. So thank you, both of you. There were lots of conversations about, please come back. And it really was, listening to the two of you was wonderful. So thank you. I think I see some some these and these. So thank you for being with us. Yes, exactly, Elizabeth. Yay. Thank you guys for being with us. Let's give them a wave and thank them for their time and energy and all they do to help all of us. And everybody have a wonderful weekend.
Bye.
Take care. Bye.
Bye-bye.